Hello, my name is Ioana PALADE and I'm a PhD student from Babes-Bolyai University from Cluj-Napoca. Today, I'm going to present a research entitled The Influence of eHealth Literacy on Attitudes and Intentional Behavior Regarding HPV Vaccination Among Young Women from Romania. First of all, I want to point out the fact that this research is still ongoing, so today I'm just going to present some preliminary data. First of all, let's talk about the problem, why cervical cancer is a problem in Romania, and also why HPV vaccination still remains a problem. Worldwide, cervical cancer remains the fourth most prevalent type of cancer among young women. And compared to other European countries, Romania has one of the highest cervical cancer incidence rates. Romanian government has certain efforts into having a better rate of vaccination. In 2020, the Romanian Health Ministry will start implementing an HPV vaccination program starting with January 2020. We live in a society where many individuals use social media platforms to discuss personal issues, including health issues. And due to the multitude of health-related information from the online environment, many individuals prefer to seek and follow advice they find on the internet rather than going to a doctor. However, the credibility of health information from the online environment is questionable, since there is a lot of information out there, and many individuals make decisions about their health based on misleading and maybe false information they read on the internet. Therefore, the patients can suffer as a result of online misinformation. The theoretical background of this paper is based on the eHealth literacy model developed by Norman and Skinner and the elaboration likelihood model. According to the elaboration likelihood model, we assumed that the female respondents perceived a level of elaboration when reading health information about HPV vaccination and the factors that females take into account when evaluating the source and the message of online health information about HPV vaccination will influence their attitudes and intentional behavior regarding HPV vaccination. We have two main research questions. The first one is, what is the general knowledge level of college students regarding health topics? And here we have multiple sub-questions. First of all, what is the eHealth literacy level of college students? What are the attitudes of college students regarding HPV vaccination? What is the intentional behavior of college students regarding HPV vaccination? What is the general knowledge level of students regarding HPV? And what is the general knowledge level of college students regarding cervical cancer? We also have another research question, and namely, that is, what is the influence of eHealth literacy on the intentional behavior regarding HPV vaccination? Regarding the methodology, we used an online applied questionnaire. We applied the questionnaire on students from College of Political, Administrative and Communication Sciences. The questionnaire was applied during their classes. The questionnaire had 33 items, and so far we have 121 respondents, It's a relatively low number, but we had to stop distributing the questionnaire for the students because of the coronavirus pandemic, and we couldn't apply the questionnaire for the students during their classes. When talking about the results, as I mentioned earlier, these results that I'm going to present are just some preliminary results, and more information is going to come after we finish this research. So we have here some graphics about how often they use certain social media platforms. As you can see, many of them use Facebook. Twitter is rarely used. Many of them don't have an account on that platform. And Instagram is used for more than an hour in every day. Regarding to Snapchat or WhatsApp, their usability is relatively low. They use it a few times a week. Or regarding to Snapchat, they don't have an account. The majority doesn't have an account on that platform. Also, most of them read health related articles a few times a week, and 24% of them read this type of articles rare. 31% watch TV shows related to health, very rare, and they find the health information that they seek and that they see in the online environment, they find it partially useful. So they don't find it really useful. 49.6% of them consider that the health information that they find in the online environment is is partially important. Most of them are trying to analyze the problems from an article when they read an health article. And most of them said that they wouldn't share in their newsfeed an article regarding HPV vaccination. 35.5% stated that they are not at all familiarized with HPV vaccination, and 42.1% said that they heard of this virus, and also the majority of the respondents rated their knowledge level as neither good nor bad. The majority answered which I don't know, or I prefer to not answer at the question regarding the fact that HPV can affect both women and males. The majority of the respondents said that HPV can be transmitted to sexual intercourse, while a great number decided to answer I don't know or I'm not sure. They have a really high percent the question regarding the factors that are risk factors regarding HPV infection. The majority answered with I don't know or I'm not sure. Also, with regards to the question, when we ask them what they think that HPV is, they prefer to answer I don't know or I'm not sure. They also don't know if HPV can provoke cervical cancer. They don't know if HPV is different from HIV. So they know that both women and with over 51 years old and younger women can develop cervical cancer. They don't know the symptoms of the cervical cancer. They know the screening procedures. They know the diagnostic. They know how the diagnostic is put, and they don't know the fact that the Romanian Ministry of Health has a vaccination campaign going on right now in this year. So as a certain conclusions regarding the first research questions, we can say that college students don't have really high level of knowledge regarding both HIV and cervical cancer. So they need to be trained in this manner. They need to learn more about this virus and this disease, and they don't find this information on the internet. So in our opinion, this information can be only transmitted through workshops or I don't know, maybe online classes held by professional doctors or any type of health specialist. So these are just the preliminary results. If you want to know the rest of the results, please follow the paper that maybe we will publish as in the following period. And thank you for listening to my presentation.